All right, we're at about 4 minutes after the hour, so I think in order to respect everyone's time, we'll go ahead and get started. First of all, I'd like to introduce myself for those of you who don't know me. My name is Sarah Struy, and I'm the CEO of the Spina Bifida Association. We're happy to host this program today. During this time of uncertainty, we felt like it was important to reach out to everyone in our community to kind of help with some mental health issues as we all try to navigate our new normal. Today, we are joined by a couple of people on our Professional Advisory Council. Tim Bry, who acts as our medical director, who is also a developmental pediatrician at Seattle Children's Hospital, is joining us. And Courtney Wolf Christensen, who is a psychologist out of Cook's Children in Fort Worth, Texas, is also joining us. We're thankful for them to take time out of their schedules during this crazy time to join us and have this discussion. Just a few housekeeping details. You can use the Q&A feature at the bottom to ask questions. We'll hold those until the end of the presentations and then open it up for questions and answers. And we'll get started with those in probably about 20 minutes into the presentations. We also are joined by some folks from CDC. We'll talk about that when we get to the question and answer session. But they're taking time out of their schedule to be able to answer questions that would be specifically around issues that CDC is dealing with. We'll defer to other things related specifically to Spina Bifida to Tim and Courtney. Please don't forget, use the Q&A feature to ask questions, and you are welcome to use the chat feature to talk with one another behind the scenes. Everyone is muted at this point. It just allows us to have a little bit of control over a large group of people. We did have about 600 people sign up for this. So with that being said, I would like to get started, and I'll turn it over to Dr. Bry.
Hello, everyone. First, I need to apologize that I am at the hospital, and for some reason, my video is being blocked. I am, at best, always technology challenged, and at worst, I don't know. But so sorry you can't see me. I am in my teal sweater today, so hopefully, even though you can't see me, you will find this helpful. We at SBA, and I personally know that there is a lot of concern about the COVID-19 virus, who may be at risk, who may be at higher risk. There's a lot of uncertainty because there's much about this yet that is still not known, and people around the country and around the world are working frantically to get more information and to keep people informed. And we know that a lot of you are worried about yourselves or your loved ones, and I think that worry or anxiety is natural to feel because there is so much which is not known. But we want to provide as much information as we know today, along with having supports about how to manage stress that you might be able to do in an effort to keep yourselves as healthy as possible, and from a public health standpoint, keep our communities and the country as healthy and safe as possible. So with that, I'll do a brief review. We do not know much about this virus. It was first identified in China in December, and subsequently spread around the world. We in the United States, in Seattle, were an epicenter for this. So we've had lots of discussions at a professional and hospital level. What we know today is that, as far as we know today, people with spina bifida, just by virtue of having spina bifida and hydrocephalus, are not necessarily at increased risk. Most individuals with spina bifida have normal immune systems and are not immune suppressed or have weakened immunity due to an illness or medications. However, people with spina bifida may fall into a category of risk. Those currently include people who are over the age of 60, people with heart disease, and that appears to include hypertension, particularly which is not well controlled, people who have diabetes, because we know that they can have circulatory issues, people with other chronic health issues, so kidney disease or liver disease, appear that they may be at higher risk as well. People obviously with respiratory issues, and the CDC includes those who have moderate to severe asthma now in that category, may be at increased risk. Finally, they are including people who, in the latest guidance, people who are obese. We do not know that obesity itself is a risk factor, but it is true that people who are obese have higher incidences of heart disease, high blood pressure, diabetes, and other things which may place them in an at-risk category. So they are including that, though in point of fact, the risk of obesity by itself is not known. There is great information on the CDC website that is updated daily, so you can always keep track of this. In terms of what you can do, this virus is spread by aerosol or by contact with secretions. That those may be secretions that are on an individual, urine or stool or saliva. They may be, we believe that the virus can also be spread by touching surfaces such as countertops or tables or computers where people with COVID disease are able to spread. The best prevention for getting COVID for everybody is hygiene. Hand sanitizer, as well as soap and water, are effective in killing the virus. Household cleaning supplies that you would typically use to clean countertops and bathrooms and sinks and toilets are effective against the virus. And so the best thing you can do is exquisite hand hygiene, particularly if you are in a situation where you are in an occupation where you cannot work from home or where you are out and about. The hand hygiene is important, but it is also important for all of us in that it's important to also keep spread from family members and protect families themselves. I think one of the critical things that is a bit different with spina bifida than some of the other populations is the need for toileting and bowel routines. And it would be recommended that you wash your hands with soap and water before doing any catheterization or any bowel routine or changing diapers, as well as after you have done that. This will significantly minimize spread of the disease within a household situation, and will keep you protected, more protected if you have to be out and about. It's also important to avoid touching your face whenever possible because, again, if you're touching surfaces that other people are using, or in situations where you don't have great control of who's around you, you can contact a surface and spread it to yourself by touching your hands to your mouth. So there are some additional specific kinds of recommendations that we have on the website, but I wanted to give that information out. I do want to emphasize that at present, as far as we know, unless an individual has some other medical reason, people with spina bifida or people with shunts are not automatically considered a high-risk group at the present time. And I will leave my initial piece there.
All right, so we want to kind of change direction just a little bit and talk a little bit about how we can manage anxiety and stress during this time. And so, Courtney, I will turn it over to you if that's okay.
Great, thanks, Sarah, and thanks, Tim. And for anyone who was on in the very beginning, I apologize for yelling at my children as they came into the room, but we are quarantining too. So I wanted to talk a little bit about uncertainty, because at this point, it is completely normal to be uncertain and to have anxiety. We're all uncertain. Our world has changed so dramatically within the last couple of weeks, and it continues to change. Things that we believed and were told last week may or may not be true this week. So how do we cope with that? So anxiety is actually our body's fight or flight response. So when you're faced with something that could be scary, right, you either stay and fight or you flee, you leave. And anxiety can be a really positive thing, because anxiety is what helps us stay motivated to do things, right? So I'm always bad about doing my notes, but I'm gonna get my notes done, because if I don't, I'm gonna get in trouble, right, at work. So that's that anxiety, that's my motivation. However, when anxiety gets to a point where it's paralyzing or it's so overwhelming, then that's when we really need to start talking about coping strategies and asking for additional help. One thing that I like to tell my patients is that anxiety is contagious. So even if you're not an anxious person, if you're in a room with someone who's overly anxious, you will start to feel anxious. Your heart might race a little bit, you might get a little sweaty, sometimes headaches, stomach aches, it could really vary, but that's not unusual. And so for those of us who are living with children in the house, it's extremely important that we figure out how to manage our own anxiety, because they're watching us. And so we need to be able to model for them appropriate coping and things to help us calm down. And I say that, and then also say I am far from perfect from doing that. When you're in a house with your kids for several days, I totally get it. But just something to be aware of is to monitor your own anxiety. Some symptoms that you might be feeling, changes in your sleep. So either having trouble falling asleep at night, having trouble staying asleep at night, or having trouble getting out of bed in the morning. Changes in appetite. Are you more or less hungry previously? Are you more irritable than usual? Having racing thoughts going through your head that you just can't slow down, you can't control them. And just things that you're worrying about, constant worry. And again, in this situation, those are all typical. And if you had said living today that you are not feeling any anxiety about anything, I would have to question whether that was really true, because we're all struggling with it. So a few things I just wanted to give you, I'm using my notes here, but some ideas for things that you can do to help you cope. So the first thing is focus on what you can control. Okay, you have to be able to come to a point where you accept the fact that things are constantly changing, and you have to be flexible about that. And that's a really hard thing to do. And let's see, so start with yourself. So remember, self-care is extremely important, right? So doing things that calm you down, doing things that make you feel happier. Focus on yourself first. The next thing is don't judge yourself. Don't judge your anxieties or those of other people around you. And something I like to tell people just in general, don't say things to yourself that you wouldn't say to another person, right? So don't put yourself down for being so worried and anxious if you wouldn't say that to a friend, right? So give yourself, just go easy on yourself. The other thing, and which is great that we're doing this so that we are connected, but staying connected virtually with friends, with coworkers, with family members, we really don't want to be isolated. And what we know is that people with spina bifida are already at risk for feeling isolated and at risk for depression and anxiety. And so this is extremely important. If you can talk to people, text people, that's great. It's even better if you can do FaceTime calls, Skype calls, Zoom calls, and see each other's faces. It really does help connect a lot better. And even if you just set up, you know, a call with your closest friend, hey, every other morning, let's just check in and see how things are going, or check in the evening before we go to bed, because it really can help. Focus on the facts. If you have questions about COVID-19, go to the CDC website, and I know that that information will be on the Spina Bifida Association's website as well, but make sure that you're getting your information from scientific sources, not blogs that you read on Facebook or tweets that you see on Twitter. Just make sure that your information is coming from a reliable source. Avoid information overload. So limit the amount of time that you're spending thinking about COVID-19 and reading about it. If you have to limit yourself to 15 to 20 minutes a day, if that's what works for you, or if it's one newscast or whatever it is, but we have to continue living our lives outside of COVID-19, because while it is here and it is scary and it makes us uncertain, we still have a lot of positive things going on in our lives that we can focus on. Have fun. So in a few minutes, I'm going to show you a coping skills kind of bingo thing that I have, but have fun, you know, do something silly, especially if there's kids around, you know, turn some music on, have fun, play video games together, whatever it is that makes you happy. And then take control, I said this before, but take control of the things that you can control. So sometimes, and especially for those of you who have kids home from school, and sorry, I'm a pediatric psychologist, so I tend to go towards the kids. But if you have kids at home, putting a routine in place, and not a routine that is inflexible, right? A routine that has plenty of space for if your children are not going to read from 9 to 10, and then at 10 o'clock, we're going to do a family exercise, and at 11 o'clock, we're going to have lunch. Because if you try to stick to something that strict, you're likely to fail. And then you're just looking back at yourself and not feeling good about it, not feeling confident. But if you set something like, hey, in the morning before lunch, I need you to do 30 minutes of your online schoolwork, that's flexible, right? And if that means doing 2 15-minute sessions, because that's all your kiddo can sit and do, then do 2 15-minute sessions. Go easy on yourself, give yourself time to calm down and do things that you want to do. However, if you are feeling incredibly overwhelmed, if you're having any thoughts about wanting to hurt yourself, we want you to reach out for help. So one of the other resources that will be on the Spina Bifida site are from the American Psychological Association, and there are multiple, there's the National Suicide Prevention Lifeline, and I'm just going to give it to you since I'm here, but it's 800-273-8255. There's also the National Suicide Lifeline in Spanish. And the other thing is this is new, but there is a crisis text line. So if you just text the word hello to 741-741, again, 741-741, there are experts on the other side that can text back and forth with you and help you kind of cope with the crisis that you're having. So you can stay as anonymous as you want. You don't have to share any of your contact information with the people who answer the phones. They are just there to support you. But please, please, please reach out if you're feeling like you need help. And lastly, so I mentioned coping skills bingo, and this is something that I typically do with my kid patients, but we can all do this, right? We were laughing, we had a little meeting yesterday kind of talking about what we were gonna do today, and several of the adults said, hey, I wanna do coping skills bingo too. So what it is, can you see these cards, maybe? So it's really a 3x3 square. It'll be on the website, but you can make it at home too. And then my kids, one is done by my son, one is done by my daughter. You can tell the difference in the amount of time that they took doing it. But they just have to fill in the squares with coping skills that worked for them. And so on the website, there will be a link to coping skills kind of focus more towards adults, and coping skills focus more towards kids. We will remind you that the ones focused towards kids also work for adults. But so if you see, my daughter said count to 10, take a walk, what is that? Visualize a calming place. My son said build something, hug a dog. That was his favorite, give a dog a hug. He said these are really helpful things to put maybe on the fridge at your house. And if you are feeling overwhelmed, or if your kids are feeling overwhelmed, this is a really good place to go to, because it takes that list of 100 or 50 things to do that can be so overwhelming, and it narrows it down to things that really would work for a specific person. And if you wanted to get creative and do bingo, you could encourage your children to either, you have to do, can you do 4 corners today? Or can you make a line? Or can you, doing the entire board might be a little much for one day. But this is just really helpful to have, because if we're feeling overwhelmed, the last thing we're really able to do is to calm down and carefully look for coping strategies. So I would just encourage you, again, there's a lot of information online in terms of mental health and support. And again, the American Psychological Association is probably the best place to go at this point. Again, go to the CDC for your medical information. There is also a mental health page on the CDC website, but also the American Psychological Association. And with that, I will pass it back to Sarah for some questions.
Thank you, Courtney. That's helpful for all of us. We've been practicing bingo as a staff for all the conference calls and webinars we've been on. And so now we're going to add coping skills to our list of bingo items to do as well. So we do have several questions that have come through the Q&A, and I will start with a couple. And please feel free to go ahead and ask questions. If we don't get to all of them today, we'll answer them and get them up on the website. And we will have a way, if you have additional questions, that you can reach out to us and we can get answers as well. So just stay tuned to our website for more details about that. So I'm going to start with the first question in the queue, and it is, are those with spina bifida and hydrocephalus who have sleep apnea, both central and obstructive, at more risk for COVID-19? And with that, I'd like to introduce a couple of our additional panelists who have joined us, Joanne Theory, I'm sorry, Joanne, if I botched that, and Allie Goodman, who both are from CDC. Joanne is a member of the at-risk task force for COVID-19 emergency response, and Allie serves as an epidemiologist at the center as well too. So I think I will turn that question over to one of our two folks from CDC, or to Tim, actually to Tim Bry. I will turn it over to Tim Bry.
So I think, so the question of, are you at increased risk with sleep apnea or other kinds of lung disease? You may be. There are certainly physical factors that with obstructive sleep apnea that may place you at risk, such as obesity. So I would say we don't have a clear answer on that from the literature, but if you have any kind of need for respiratory support, like a sleep apnea machine, I would certainly exert additional caution in terms of hand hygiene and staying at home and avoiding crowds and trying to work from home. I think if you have significant scoliosis, you're automatically going to have an element of what we call restrictive lung disease. That just means that the back curve does not allow your lungs to expand as fully, to get as much breath support, and to be able to get as much oxygen and get rid of as much carbon dioxide. So I think people who have scoliosis are people who are at increased risk.
Thank you, Tim. The next question is, starts, I'm sorry to hear that specific populations are at increased risk. I'm surprised to hear that kiddos or adults that have had a Mrsa or MACE procedure are not at risk since they have exposed openings. Can you please address that?
That's a really good question. And again, I think as it relates to Spina Bifida specifically, there is a lot we do not know. But I think the main issues are that for a Mrsa or catheterization or a MACE, you would get infection by spread from other secretions. And so again, I think good hand hygiene before you do any kind of procedure and after you do a procedure is what's going to protect you. The virus seems to be spread by the secretions we make. So you would not necessarily be at increased risk if you yourself don't have COVID actively. But if you require help or assistance, that spread would be more likely to be from close contact and cough or aerosolized particles than it would be. And remember, soap and water, washing your hands for 20 seconds or using hand sanitizer kills it. So the actual, by washing your hands appropriately before and after, particularly if you have people who have to help you, would avoid the spread via the MACE or the catheterization. But there would still be potentially a risk if somebody is close to you sick, but having to help you in some way of spread via aerosol or coughing or sneezing. But the Mrsa or the MACE themselves would not necessarily place you at increased risk.
Okay. The next question has to do with lymphedema. If someone has lymphedema, is their risk heightened in getting the virus?
That's a good question, and I'm going to have to say that I don't fully know the answer to that one. That would be one that we would have to research. I think, again, if you have lymphedema, that is often co-associated also with obesity and potentially poor circulation or heart disease. So I don't know if the lymphedema itself places you at risk, but certainly if you have lymphedema and are obese, or lymphedema and you have high blood pressure or heart disease, that then places you at a higher risk category.
Okay.
I don't know if the CDC folk have any additional comment on that.
Joanne or Allie, do you have any additional insights on that?
This is
sure. Oh, go ahead.
No, I'm just saying it. This is Joanne. I think that's a better question for Allie.
Sure. This is Allie Goodman. I'm a pediatrician, an epidemiologist at CDC working on the response and the at-risk task force with Joanne and Georgina Peacock and others. I totally agree with Tim. I think we have really insufficient information to know yet about a lot of the specifics of these conditions. We just don't know. But I think that Dr. Bry's answers regarding, how these things could be related and whether they might, put people at risk are perfectly sufficient. We'll be receiving more and more data over time, and we hope to have better answers soon regarding some of these specific questions. But in the meanwhile, talking to your own clinician or other, really educated clinicians in the field is probably the best way to get answers for your questions.
Okay. Thank you, Holly, for that. Just to add, I would say that probably for all of us at this point in time, erring on the side of caution is probably wiser than taking a chance. So just making sure that we're using good hygiene is really critical, and we can't emphasize that enough. So making sure you're washing your hands, that's really important. That brings me to the next question, which is about wet ones. Someone comments that many of people use those for cleanup. They say antibacterial, but do they work for COVID-19?
I'm sorry, I missed part of the question. It didn't come through.
Okay, sorry. The question was about wet ones. They say antibacterial, but do they work for COVID-19?
I would assume, well, I shouldn't assume. That's a bad thing to do. They're certainly better than nothing. I don't know if the CDC people with regard to specific products have it, but I would think that if that's all you've got, then that's better than nothing. I think hand sanitizer may be a better alternative if you have it, or if you use wet ones, washing your hands at the next available opportunity, I think would be important. But I don't know if, with regard to that specific product, what its antiviral capabilities are with COVID.
And this is Allie Goodman. I also am not aware of the specifics for those wet wipes, but CDC's COVID website does have some really good information about the contents of different products and what you want to look for. So if you just Google, CDC COVID-19 and wipes or disinfectant, it'll bring you to a really helpful website.
Thank you.
This is Joanne. I just wanted to add that there are general recommendations for routine cleaning and disinfections for households, and you can also find that on the website.
I'll put that website into the text chat right now.
Great.
Okay, thank you. And the next question has to do with epilepsy. If I have spina bifida as well as epilepsy, does that make me at a higher risk because of the epilepsy?
Again, we don't have that answer for sure. I did check with the Epilepsy Foundation website this morning, and at present they are not necessarily feeling that people with epilepsy, particularly if it's well controlled, are at increased risk. Again, this is new enough that I think we don't have a lot of specific information, but again, they are recommending, they are not considering epilepsy itself as an increased risk factor necessarily.
Okay. All right. The next question has to do with T-level defects. Are people with spina bifida who have T-level defects affecting torso and breathing more at risk?
Again, individuals who have thoracic level spina bifida are at increased risk in general of not having as full of lung expansion and as good of an ability to clear your airway of secretions. So I would consider that to be potentially a high-risk group, particularly if you're an adult. I personally would. Again, the specifics from the CDC are not there, but T-level defects are known to have more of an issue with, again, what we call restrictive lung disease, where the lungs don't expand as fully and are more likely to have scoliosis as well. So again, I think if you've not been diagnosed with lung disease related to your thoracic level or have not had significant scoliosis, I would still take extra precaution and presume that you are going to be in a high-risk group. That would be, to my mind, the safest thing to do.
Thank you. I have a question that's interesting, and I think I will pass this off to the professionals at CDC. Why is COVID-19 referred to as a disease? I've been hearing it referred to this way. To me, disease is a chronic condition. I'm just curious.
Joanne, do you want to take that or should I?
Yeah, go ahead.
Okay. So COVID-19 refers to the disease, in other words, the illness that's caused by the SARS-CoV-2 virus. So the virus, as you know, is related to SARS. It's called SARS-CoV-2. It is the same as, what people refer to as the novel coronavirus. The illness that results from it has been called COVID, or coronavirus-related disease. Does that help to answer the question?
Well, I think the underlying issue is, some people assume that disease is something chronic, but disease is not necessarily chronic. It can be acute as well, right?
Correct.
So I think that's the difference. This is more of an acute setting versus a chronic setting. So you have to look at disease in kind of through two different lenses. For a lot of people, it's chronic, it's ongoing, it doesn't go away, things like diabetes, things like that. But for something that's more virus-related or infection-related, those typically have a start and a finish. So that's the difference, but they are both diseases. All right, the next question has to do with wrapping back around, Dr. Bry, something that you mentioned earlier about shunts. You mentioned that shunts themselves weren't a factor at this point, but what about those shunts that rest between the lining on the surface of a lung? Can that lead to more extreme complications if someone gets COVID-19?
So I don't think that a person who has either a shunt that goes to the lining of the lungs or a person who has a shunt that goes into the heart or a shunt that goes into the abdominal cavity is necessarily at increased risk of catching the disease. But there would be concern, I think, that if you caught the disease, if you caught COVID and had active COVID infection, that might be a factor which would potentially increase your risk that the disease may be more severe, because the tubes themselves are not the risk factor, but where they go, if they go to the heart, what does that do? we have to assume that if people are getting sick with COVID, that it's not just staying in their airways of their lungs, but would be circulating in the other body fluids. And so I would think that those might be factors not for catching it, but for illness severity if you caught it.
I'm going to switch gears for just a second. Looking at the chat feature, there are a couple of questions that come in that way as well too. One question is, if you have Spina Bifida and Mrsa, are you at increased risk?
My feeling is that you would not necessarily be at increased risk. Again, I'll leave it to the scientists at the CDC, but a number of people are colonized, meaning that Mrsa is on their skin or on their body, but they are not getting sick from it. And we do not know that having Mrsa colonized, as opposed to being actively ill with it, with Mrsa, would be any more of a risk factor.
Okay. And the frequent UTIs, does that increase your risk?
We also don't believe that frequent UTIs in and of themselves increases the risk. That is bacterial, but again, I think the critically important thing is appropriately washing the genitalia with soap and water, and cleaning, and also the hand hygiene before and after as a way for it to the virus to spread. But I would not view urinary tract infections in someone with spina bifida in and of themselves to make a person at increased risk of getting the virus.
Okay, thank you. The other question that came in has to do about mask wearing. It says, I can make my own fabric mask. Is it better to wear one or not? I see people with gloves out in public, but they aren't washing hands and not touching your face. The best way to prevent it, wearing gloves won't help unless you remove them the correct way and don't touch your face with them on. So Joanne or Allie, could one of you address that, please?
This is Joanne. What I can say right now is that what we know is that people can protect themselves from illness with everyday preventive actions. You know, if possible, avoid close contact with people who are sick, avoid touching your eyes, nose, and mouth with unwashed hands, wash them often. If you don't have soap and water available, you can use an alcohol-based hand sanitizer that contains at least 60% of alcohol. Continue to practice good hygiene and social distancing where feasible.
At present, if I'm correct, the CDC is not recommending for people who are hoping to prevent getting COVID that masks would be useful in that regard. And I think many of the people, we here in Seattle are in a stay-at-home order under our governor. And so people are ordering in, or you can go to the grocery store or the drugstore, for example. I think many of those workers use gloves in an effort to kind of decrease their own skin-to-skin contact. But the gloves in and of themselves are not going to protect people from getting it unless they're washing their hands after they take off the gloves and keep from touching their own faces, etc. So I think people who are still in industries like grocery or drugstores are trying to use those as a preventative measure, but they in and of themselves are not effective without other good hand hygiene.
Okay. The next question has to do with wheelchairs, and I'm going to try to combine a couple of different questions that come in. One has to do with if someone's a full-time manual wheelchair user, does that put them in a high-risk group? They thought maybe because of anything respiratory seems to take a little bit longer when you're seated so much. And the other question is, you know, people have to touch their wheelchairs, and their wheelchair wheels touch a lot of different things. And so how long would the virus live on a wheelchair, and what's the best advice in terms of how to handle all the touching you have to do of wheelchairs? I guess it's the best way to put it.
I think that that's a really good question, and that I think is really a challenge. I think the best things that you can do if you're in a wheelchair, again, are to think about the fact of how much movement are you able to do. So are you totally wheelchair bound, or do you use it primarily out in the community, but you walk at home? Those may be different factors, because you might be at some decreased risk of having the restrictive lung disease if you're still ambulatory to be able to do some walking, versus somebody who is, again, a thoracic level and absolutely dependent on the chair. With regard to the chair, I think the best things that you could do are, number one, if you're going out, and again, for example, in Seattle, our stay-at-home order still allows us to go out for walks or to walk our dogs or whatever, is to practice that social distancing where you're at least 6 feet from other people, both side to side and in front of you or in back of you. That seems to be a critical distance that would reduce spread from coughs or sneezes or secretions. I think that I would make the assumption that the virus could, if you're in contact in an office or whatever, that the virus could come in contact with your wheelchair in some inadvertent way. And so again, I think frequent hand washing or hand sanitizer in those uses. And then I think at the end of every day, rubbing down your wheelchair with a cleaner that we know is effective, such as you would use with household cleaning, would help reduce the chances that this virus is going to live on your chair. I wouldn't say that you're necessarily, again, at absolutely increased risk, but I think that requires, again, extra precautions in terms of thinking about how you approach your own hygiene and hand washing, and what you can do with your chair to kind of try to do that. So just as we're supposed to, when we clean our houses, we're now supposed to wipe down tables and door handles and other kinds of equipment that we wouldn't typically think of and clean in that way as frequently. Doing the same with your wheelchair may be valuable.
And this
to
is
protect yourself.
Joanne. I would also add that I think that's a really great response, but I would also add, if you have any other assistive equipment, other than a wheelchair that you might use, it would probably be a good idea if you're that you would clean and disinfect those also, since they are pieces of equipment that you might frequently touch on a daily basis. And again, I would refer you to the CDC website for some general recommendations for routine cleaning and disinfecting household items. These can also be used with assistive devices.
Well, I think we have enough time for about one more question, and there are still 50 questions in the queue. So rest assured, we will take all of these questions, get them answered, get them up on the website, and let you all know that they're available. So we're not going to stop answering questions. It just may take us longer than this hour to answer all the questions that everyone has. The last question has to do with medical supplies. In particular, people are having trouble getting access to acquiring wipes to clean genitalia for CIC. So what are some good alternatives other than soap and water, particularly if you do have to be out and about and you don't have access to that?
Again, I don't have a great answer for you. We know that people are struggling to find enough hand sanitizer. Again, I think looking on the CDC website for different types of cleansers and what might be available and what might work. I frankly keep a little like a travel-sized bar of soap wrapped in a plastic bag in my bag so that I can always use some soap and water if I need to. And then you could use paper towels or something like that along with soap and water for cleaning. But again, the CDC website has the most up-to-date information in terms of appropriate cleaners for different kinds of use. But I think that is a really good question. And I think the other piece of that question is, would be asking yourself, do you have to be out and about? So you may have to be for your job at the present time, but if you're out and about, what are the reasons that you're having to be out and about? And working with the people who are either your employer or your volunteer work or whatever you're doing, to see whether there's the ability to work remotely so that you're not caught in a situation where you're out and you have to catheterize and you don't have the right wipes or the ability to use soap and water. So I think, again, it's thinking through the situations that you're in and are there ways that you can adjust those. Employers are going to be increasingly looking at remote working opportunities, etc. So I personally question myself, do I have to be out and about? And if I do, can I time it related to my bladder and bowel routines and try to make it work? I think Joanne just put up additional information from the CDC website.
Right.
Or sent that out.
Yes, those links were put up there. So
yeah.
I think we also need to do, that's a good question, in reference to supplies. If you are having trouble getting supplies, particularly catheters, let us know through the Resource Center. Best way to do that is through email, and Juanita can put up the Resource Center email address in the chat feature. But we are in close contact with a lot of the suppliers, and they are working hard to make sure that those supplies do stay in the pipeline. They have put plans in place and they are really monitoring all of this, trying to make sure that people get what they need. So if you're having problems, if you're experiencing difficulties getting supplies, please let us know through the Resource Center. And with that, Courtney, I'm going to turn this back over to you because we are at the end of our meeting time, and I know that you wanted to do something with all of us.
Thank you so much. Sorry, real quick, going back to if you're having trouble getting supplies, because I'm in urology, you can always reach out to whoever is writing the script for those supplies, whether it's urologist or pediatrician, and they can always contact the suppliers on your behalf as well. And oftentimes clinics have extra catheters and stuff that we can give to you. So, okay, so what I wanted to do is, this has been a lot of information, and it looks like we'll be posting lots of answers and more resources. But I wanted to run through a really quick breathing exercise with everybody. And this is something that you can do anywhere. So no one even realizes you're doing it. If you're starting to feel overwhelmed, my daughter asked me the other night, how do I get my heart to slow down before I go to bed? Those kinds of things. And so it's super easy. It's called Foursquare Breathing. So what you're going to do is, we'll go through it together in just a second, but you're going to breathe in for a count of 4. And when you breathe in, you're going to breathe through your nose, almost like you're smelling a delicious birthday cake. So for 4 seconds, we're going to breathe in. We're going to hold that for 4 seconds, and then we're going to blow out through our mouths for 4 seconds, like we're blowing candles out on the cake. So you have this beautiful cake, you're going to smell the cake and then blow out the candles. And then we do it 4 times. Super easy. So you can either do it with your eyes open or closed. It's completely up to you. But everybody will kind of get in a comfy position. And so we're going to breathe in, 2, 3, 4. Hold it, 2, 3, 4, and blow out, 2, 3, 4, and do it 4 times. So hopefully that's just a really easy thing that y'all can have kind of in your back pockets, to something to pull out when you are starting to feel overwhelmed, or if your kids are starting to feel overwhelmed, that's a really good exercise to do with them too, because it's super easy. If you do close your eyes, you can focus even more on your breathing in your body and calm yourself down.
All right, thank you, Courtney. I'd like to thank Courtney, Tim, Joanne, and Allie for joining us. I'd like to thank all of you for taking time out of your day. This video, I believe we did archive this, and so you should be getting information about that as well. But again, thank you very much for taking time out to join us for this. If you have thoughts around other webinars that might be beneficial during this time, please don't hesitate to reach out to Juanita at the Resource Center, because we will be looking at how we can interact with our community during this crazy time to try to help as much as we possibly can. Just so you all know, we are still working at SBA. We're working remotely, but the good news is we were set up to do that before all of this, and that we are continuing to work on our strategic plan. And I promise you that we will get to all of the questions that have been given to us today. And we appreciate your time. Take care of yourself, stay safe, wash your hands. Bye, everyone.
Bye.
Bye.